Greetings from Sanjeevini Hospital. This is Dr. Subhash, MD of a super specialty hospital located at West Bangalore. Herein I am featuring a case most commonly prevalent in our country, a case of tuberculosis, who is suffering for the past 5 years. This is a patient who is 65-year-old, loss of appetite, fatigue. He was cacaxic and he was not able to walk. There was shortness of breath and he was always fatigued. He has shown to a lot of places and he has taken the medications also properly. This was more like a case of MDR, multi-drug resistant tuberculosis. It was not helping him. Later on, the left apical lung got damaged and a lot of fluid started getting collected in the lungs, for which they had put a ICD. ICD means intracostal drainage, where you connect a tube to the chest and leave it in underwater seal so that whatever the air of the fluid which is collected in the left part of the lung is brought into the tube, into the bottle. He was with this ICD in the past 3 to 4 months, and this was a case to be salvageable. But because of his complexity of the condition, his age, and his other risk factors, like he was having ischemic heart disease, his ejection fraction is only 35%, mild MR, moderate TR. His heart condition was also bad, 65-year-old, with the tuberculosis, wherein it is multi-drug resistant, and is not able to recover himself. There is always a risk that this patient will collapse on the operation table. They had commuted to a lot of places. They had gone to a lot of hospitals in Bangalore, outside the state, even in Delhi, but they couldn't get much of a relief from all these things. We came to know about this case, that the patient is there like this, and we wanted to take it as a challenge. I discussed with our cardiothoracic surgeon, namely Dr. Rajshekhar Reddy. We did a consultation, and it was a very high risk case, but we told yes, we would have to give relief to this patient. We had to mobilize a lot of teams, mainly a pulmonologist, an intensivist. We had to mobilize a cardiothoracic surgeon. We had to mobilize 2 of them. We had to mobilize anesthetist, and it was an infected contagious case. So we took it as a challenge and we wanted to operate on this case. We informed the patient that this is going to be a marathon surgery and this is the procedure which we are going to be doing, like left thoracotomy. Explained to him what all it might be happening and what are the complications which are happening. Looking at all the paraphernalia of the medicines, of the surgical instruments required, we were very happy to say that Dr. Rajshekhar Reddy, the cardiothoracic surgeon, more than obliged, brought in his team and gave his most efficient best to treat the patient. We had to cut open his chest from the 3rd rib to the 7th ribs were removed, opened, and we are very near to the heart, and heart function is only 35%. We had explained all the rest to the patient. We opened the chest, and on opening we could see that his left apical part of the lung was completely damaged, and above that he had a bronchopleural fistula, means wherein the oxygen which we breathe in has to come out as carbon dioxide. But here patient breathes in, some of the air is escaping out through the bronchopleural fistula into the ICD, and is not maintaining his saturation well because of this condition. So we had to remove a part of the lung and we had to seal the bronchopleural fistulas. So we brought in the serratus anterior muscle, closed in the bronchopleural fistula. It was a long surgery, and we closed him and we shifted him to the medical ICU. The most important part for this complicated surgery, the most important piece is the post-op care. We were very worried about him post-operatively, wherein a lot of complications also can happen. Our ICU team was a very efficient ICU team. We shifted him to the medical ICU. We thought that the next 24 hours would be very crucial for us. But this gentleman, a 65-year-old with an ischemic heart disease, with an ejection fraction of 35 to 40%, walked the next day after the surgery. We were so enthralled by this incident, and even the intensivist was very happy. The patient himself was telling, now I am not feeling breathless. That was the efficiency and the meticulous surgery which was done by our cardiothoracic surgeon. The patient recovered fast, though we had to keep him for a longer duration of time in the hospital to prevent the cross infections, and we shifted him to a guest house, a long stay with physiotherapy, recovered him completely. This we did it about 2 months back. Incidentally, I happened to talk to him yesterday to check out how many days he is suffering from. He told, डॉक्टर साहब मैं भी बहुत अच्छा हूँ, 5 साल से सफ़र किया था, अभी 2 महीना हो गया, मैं बहुत अच्छा हूँ. And he told, आपके लिए बहुत बहुत शुक्रिया साहब, मैं अच्छा हो गया. And he asked me, sir, my wounds are clean, there is no liquid draining out or anything, should I come back? I told, if you're doing well, enjoy your life. Thank you.
আমার বাবা নাম হলো যতীন্দ্র মণ্ডল, ওয়েস্ট বেঙ্গল থেকে আসছি। প্রথমে একে ওই আমাদের ওখানেই মানে শিলিগুড়িতে ডাক্তার দেখিয়েছিলাম, সেখানে একটা টিউব লাগিয়েছিল। টিউব লাগানোর পরে মানে জল জমেছিল বুকে, টিউব লাগিয়েছিল, সেটা জলটা বের করেছে। বের করার পরে সেটা সাকসেস হয়নি। তারপরে এখানে আমরা তো ব্যাঙ্গালোরে চলে আসলাম। তারপরে এখানে সঞ্জীবনী হাসপাতালে দেখালাম। দেখানোর পরে সেখানে অপারেশন হলো সিকিউরি স্যার আর রেড্ডি। তো দেখে এখন দেখছে এখন ভালো আছে, ঠিক আছে, সুস্থ আছে। সঞ্জীবনী হসপিটাল, মহালক্ষ্মী লেআউট।